Is autism. Autism is a very common neurodevelopmental disorder. Autism is a lifelong developmental disorder that affects 1 in 68 individuals. A neurodevelopmental disorder is a disorder that affects the brain and interferes with normal development from before infancy to adulthood. In the DSM-5, which is the most recent edition of the Diagnostic Statistical Manual, the term autism spectrum disorder replaces 4 separate disorders and instead categorizes them as a spectrum disorder based on severity levels. These levels are based on the level of support and care that the individual requires. Level 1 would need some support versus level 3, which would require very substantial support. Autism is a spectrum disorder, meaning that although each individual with the diagnostic label ASD shares certain symptomology and difficulties, this manifestation affects them in different ways. For example, some kids are oversensitive to stimuli and undersensitive to others. There are kids who have savant skills and others with severe intellectual disabilities. There's a phrase that summarizes this. If you've met one kid with autism, that means you've met one kid with autism. So the Diagnostic Statistical Manual identifies 2 main criteria for the diagnosis of ASD. The first being a deficit in social interactions and communication, including social reciprocity, a lack of nonverbal communication. So people often mistake a lack of verbal communication as a prerequisite for ASD diagnosis, but that is not necessarily true. Rather, language is a socially acquired skill, so social withdrawal, which is seen in those with ASD, results in a lack of verbal communication. And there's also deficits in maintaining or developing relationships. Then the second criteria is restricted or repetitive patterns of behavior, including echolalia, idiosyncratic phrases, and fixed interests of unusual intent or focus. Other associated features include intellectual impairment, which explains high rates of comorbidity between intellectual disabilities and ASD, and motor deficits, so clumsiness and unusual gaits. Although we know more than we have ever known before, the etiology of this disorder is still a mystery, but research suggests that a combination of factors, including genetic and environmental, may account for changes in brain development. Nonetheless, there is no cure, but there are interventions. So ABA is the most successful intervention for ASD. It is a set of principles that form the basis of many behavioral treatments. ABA is based on the science of learning and behavior and includes laws about how behavior works and how learning takes place. ABA therapy applies these laws to behavior treatments in a way that helps to increase useful or desired behaviors.